Hello, this is your host, Tracy Howcrumby with Beauty for Ashes with Tracy. And we are a self care, mental health awareness podcast that enlightens, inspires, and encourages listeners on how to create wellness. And we also offer strategies for a healthier mindset. How is everyone doing this afternoon? I hope everyone is well. I'm good. I'm good. We're past our Valentine's Day. We're past my birthday. So we're at a different episode this week. And I wanted to share with you about mental health first aid, mental health first aid certification training, and the benefits of becoming a mental health first aider. First want to just share with you, as you've been seeing in my advertisement and you see some of my posts, that is the educational training for my nonprofit organization, Joyside Tears. The educational training that I offer is mental health first aid. Mental health first aid is a 3-year certification training that offers all first aiders the resources, tools, skills, and everything to be able to identify, understand, and respond to signs of mental illness and substance use disorders. It gives you the skills you need to reach out and provide the initial help to someone who may be experiencing or developing a mental health or substance use problem, or as well as to experiencing a crisis. So this is what we do. So if you become mental health first aid certified, you would be amongst those who are teachers, first responders, and veterans. You would be neighbors to someone, parents, and either friends. You will also be a person who may be in recovery, or you're there to support a loved one. Mental health first aiders, they are ladies and mayors, anyone who wants to make their community healthier, happier, and safer for everyone. So this is why mental health first aid is important. And just to give you a little bit of insight on who are the mental health first aid trained. So we, Mental Health USA, Mental Health First Aid USA, have reached more than 2.5 million people across the United States. And we have trained in mental health first aid also more than 1,500, 15,000 instructors. And guess what? I'm a part of that group of the 15,000 instructors. So I decided to get mental health first aid trained because during a point in my life, experiencing the loss of my son, I did not know what to do. I did not realize any signs or symptoms that would have alerted me to this is where he may have been um, experiencing or thinking about for suicidal ideations. So now I'm at the point where what I've learned, I just want to share, and I also want to train people in the same way. So mental health first aid does matter. And I'm going to give you a little bit of information about it. Most of us wouldn't know how to help someone if we saw them having a heart attack. We start CPR right away, or we'd at least call 911. But there are few of us, very few of us, who would know what to do if someone was having a panic attack, or if they were concerned that their friend or coworker may be experiencing some signs of alcoholism or mental health issues or mental illness. So what this does, mental health first aid, it just takes the fear and hesitation out of starting a conversation about your mental health or substance use problems. So it improves the understanding and it provides an action plan that teaches you the responsibility to safely identify and address these potential mental illnesses or substance use orders. Now, we do not diagnose as mental health first aiders. We do let the professionals, your psychiatrists or your counselors. They're the ones that diagnose. We do not diagnose, but we are there and we are equipped with the tools that someone would need to start the dialogue and to get the people help that they need. We are a vital link to someone experiencing these challenges. So, if you wanted to become a mental health first aider, what you would do if you were going to take my class, I would let you know when we would have a class started. I teach corporately as well as individual classes, but my individual classes can be virtual. Most corporate are in person. Some of those would be virtual, but bulk of it, it doesn't matter what state you lived in, what side of the world. We would just set up our time frame to know I'm on Eastern, so you would have to be attending a class virtually that started on Eastern Standard Time. So, with that being said, there would be some coursework to complete. So, we wouldn't have an 8-hour day. You would complete some self paced online learning until we had our virtual class meeting. And to start a class individually, I would just need 5 individuals to start a class. We don't hold classes for one person or two. We have a 5 person minimum, and we can go up to 30 people. So, just to know a little bit about that. So, what we want to figure out is what's the impact that's being um, had across the globe with mental health first aid. And there's so many people that we're finding issues that are most appropriate to take to our school. So in a article for Mental Health First Aid USA, the media contact talked to someone in Washington. This was from Washington, D.C. in January of this year, that school board members nationwide consider student mental health the most pressing issue facing schools today, according to a national survey of school board commissions commissioned by the Mental Health First Aid USA. So, again, with that being said, the school board felt that 86% are a concern. That's the number one concern out of 86% of the school board members is the mental health uh, dialogue that needs to be had, as well as the education. So, by student health being number one in school boards, they're either reporting that it's an extreme concern, they're very concerned, or it's a high level of concern than expressed for school funding. So we're constantly working on how to get more funding. Even my organization, right now, we provide our classes for free, but we are also seeking funding so that we continue to educate in mental health first aid. So the schools express the funding, they also express staffing challenges. They're expressing school safety. So, at a time when so many of our children are facing mental health or substance use crisis, they recognize, which is the school boards, that we need to respond. They also know that the schools, the families, and the teens themselves can play an important role in how they address one another, and they are eager to find the tools that can help make a difference. So, with the training, there is an adult mental health first aid, which I am an instructor as well as certified in, and there is a youth mental health first aid. And that's also part of a teen component. So they have teen and they have youth. So it's been proven to be a valuable resource for more than 700 schools in 36 states. So this does come at a time where the nation continues to grapple with mental health crises. Now, not only is suicide, the third leading cause of death for youth 15 through 19, 1 in 4 adolescents aged 12 to 17 have had a substance use disorder and or major depressive disorders in the last past year. So these numbers are continuously increasing. So we strongly know that as an advocate that I'm with NAMI. As an advocate, I'm also with the American Foundation for Suicide Prevention. And we know at state and local levels, we advocate with policymakers. And we have to do this a great deal more because this addresses student mental health. It addresses state legislators to do a great deal more. It also addresses our county officials as well as the need for them to do a great deal more. We have made strides and came a long way, especially getting the lifeline with 988 and all of those things set up so it can be a national thing. So we need to just know, though, when it comes to recognize the signs of a student experiencing mental health challenge, including thoughts of suicidal behaviors, that it ranks higher that the parents, close family members, and friends are most likely to see the signs first. So we need to know how to recognize the signs and what important first steps that we need to take as an individual. So we need to become mental health first aid trained and develop the skills to help someone who may be developing a mental health or substance use challenge. And all the evidence are pointing towards not only just um, the young America, but also still within our adults. But they're seeing a high rise evidence training in the teen mental health first aid that grades 10 through 12 or ages 15 to 18 identify the signs and symptoms the most right now. But what we need to just understand that there are ways, and mental health first aid is one way that we can teach the young people as well as our adults how to open a supportive conversation about mental health and substance use with your friends and the people that are most important to you, and how that they can seek the help of a responsible, trusted adult if you are talking to a minor or adolescent. So you need to point them also in the right direction. Once again, the mental health first aider would not diagnose, but we would be able to have an action plan available if we encountered someone who was experiencing a mental health challenge or a mental uh, substance use disorder, as well as a mental health disorder and challenge. So, what we want to do is first understand that in the peer reviewed studies, the training increases learners' knowledge of the signs, of the symptoms, and of the risk factors associated with both the mental health and substance use. So, we become more confident in our ability, and we are helpful in the likelihood to get an individual help that's in distress. So this makes the situation a little bit more easier to be resolved if we know how to handle situations and not try to shun from the responsibility or negate a opportunity to help someone because we don't know what they're experiencing or how to help them in that way. So we do have a lot of self-help resources for individuals. And we do have a lot of information out here that would help people in distress or that's going through any challenge that refers to your mental health. So once again, this is a evidence-based training administered by the National Council for Mental Well-being, and it teaches you how to identify, understand, and respond to signs of mental health and substance use challenges. Now, we have more than 2.9 people across the United States that have been trained in mental health first aid by a dedicated base of 15,000 instructors. And once again, I am one of those proud instructors. So if you are interested in mental health first aid training, adult mental health first aid training, do go to my website, joyinsidetears.com. And I'm going to have that listed here. You're going to go to joyinsidetears.com, or you're going to go to info@joyinsidetears.com, because these are all information. These are all pieces of information and resource that we need to make sure that in these times and crisis that we are able to help someone. So we're going to definitely go to joyinsidetears.com. It's going to be one of those things there. And we're also going to go to, for info on when our classes are, you could go to info@joyinsidetears.com. And I don't know why I didn't have this done first. I was so excited just to tell you a little bit about it that I forgot that you do need to know where you can reach us. info@joyinsidetears.com. And so this is where you can email my organization and we can help you to get a class. Once again, the classes are free and you won't have to pay for any classes. And we're so happy to probably share with you all the knowledge that I have been given through this training, because we are suffering in silence in many communities. And I did not know the what encompass mental health first aid, because someone may think that person may just be mentally distressed, but it is panic attack, it is eating disorder, it is a schizophrenia, it is a person who suffers from bipolar disorder, it is a person who suffers from hallucinations, it is a person who suffers from substance abuse, it is a person who suffers from suicidal ideation, it is a person that suffers from depression, it is a person who suffers from anxiety. There are so many things that mental health encompasses, that is just not about someone not in their right mind as we used to identify mental health with. So we're eager to share all the information. And once again, this is a 3-year certificate training. After you complete your mental health first aid training, we provide a certificate to you once it's completed that is good for 3 years. Once again, this is just like your CPR training or your basic life support, where you would be certified for the 3 years through your American Red Cross or whomever you take your CPR training through. We certify you for 3 years. And in that time, you're also able to um, become an instructor if you decide to. You're able to help in any capacity. There is so much. Corporately, we're reaching out to people and organizations because we realize this is a workplace issue. When you're at work and you're missing work or you're not functioning properly at work, and you have your departments that deal with the mental health piece, whether it's your employees assistance program or whether it's your human resource programs, we need you trained as well. We need educational staff at the schools trained. We need everyone trained to be able to identify and help someone that is in need, that is suffering a mental health challenge. So, with all that being said, I thank you so much for your time. We're also going to be able to give you another episode. I can go much deeper into this, but this was just an informational to let you know what I do offer through my organization, Joy Inside Tears, which is a nonprofit organization. It is a 501(c) organization. All proceeds are going. If you give to Joy Inside Tears, this is what it helps to do. It helps support those in mental health. It helps provide resources, advocacy, which means I'm advocating for you. I'm with the American Foundation for Suicide Prevention, as well as with NAMI in Georgia, which is the National Alliance of Mental Illness. So we want you to continue to get the help that you need to make sure that you're in the uh, right place to help someone who may be experiencing a mental illness. Because this is what it's all about, the help that we need when we are experience a challenge and when we don't know what to do, we don't know how to help, but we can help you to help others. Let's get involved. Let's get involved. Let's advocate. Avocation means reaching out to your local government, your state government, your legislators, your senators, letting them know how much we need the resources, how much we need the trainings, how much we need to be educated, how much the providers like your counselors and your therapists, how much they need the resources to provide the services that their insurance can pay for. So that also sometimes gives issues in that way, because you're going to your providers and your insurance may not be able to cover uh, your mental health the department that you're going to, that you have to get the help through. All I'm saying that the insurance sometimes may not cover those treatments. That was the word. I get so passionate. I sometimes lose the thoughts of what I wanted to say, but either way, I think you know what I'm talking about. I think you know where I'm going with this, and I've made it very clear. Mental health first aid trainer is essential to our very being, for all of us, for our communities, for our homes, for our families, for our churches, for our workplace. There are so many people who need your help as well as my help. Consider becoming a mental health first aider. Once again, Joy Inside Tears. Go to joyinsidetears.com and you can look at my website. It's a very, very nicely laid out. Please donate. When you do that, you're helping me to provide the training services for free. You also can go to info at Joy Inside Tears. That's the contact page, or that's the email that gives me the information, and I can let you know a class schedule that's coming up for February and March. I am full for Saturday classes, and I will open up some more classes in April. Um, Joy Inside Tears is so busy for the cause. We're offering support group meetings, and those can also be virtual as well as in person because we have them in the community. I appreciate your time. Thank you so much for listening. And as I said, supporting all the platforms that I am on, because this is not about me. This is about me being commissioned to help you to understand that we are all in this together, and we are in a national crisis with suicide, and we need to know how we can prevent suicide if at all possible. And it is possible if we are trained in how to combat and how to impact the lives of someone else through the training. This is Tracy Halcrumby, your host with Joy Inside Tears, as well as Beauty for Ashes with Tracy. I love you all. Thank you for tuning in, and I will talk to you soon. On the next episode, I'll also give you more information about mental health first aid and the essential actions of mental health first aid. Thank you for tuning in to this episode on mental health first aid informational. I appreciate it.